Be sure to join UConn men's basketball coach Jim Calhoun in the fight against cancer. The Calhoun Cancer Challenge bike ride is next week, and much of the money raised goes to UConn Health Center's NEAG Comprehensive Cancer Center. Joining me now is the head of the center, Dr. Carolyn Renovitz. How are you?
I'm good. Good morning.
Good morning. So let's talk a little bit about Coach Calhoun and his work with UConn and how you all helped him. Several bouts of cancer he endured.
He's a real legend.
He is.
And I think he's a good example of where we are with cancer. Unfortunately, we still have cancer, but fortunately, we're doing so much better in curing cancer and having cancer survivors. And he's a great example of somebody who gives back, who has had cancer, is very grateful, and raises money and awareness for us.
Speaking of him giving back, he shows up at this event. He brings players. Explain, it becomes a who's who. It's fun. It's a cycling and a walking event.
It is. This year, his wife actually is joining us to lead the walking event. And it's really fun. He comes out, he brings his whole family, parts of his family lead teams. He actually rides, and he rides with some of his old players. So it's just a great day. It's really fun. You get good activity, good exercise, and you're donating to a really good cause.
And let's talk about your center, the Comprehensive Center. Let's talk the advances made in cancer treatment. You all have made some pretty, I would say, very interesting and very great strides.
Absolutely. There's no question that we are winning the war on cancer, and we're very much a part of it at the NEAG Comprehensive Cancer Center at the University of Connecticut Health Center. So we have the entire spectrum, from prevention to early treatments to, unfortunately, advanced treatments, and then cancer survivors. We have a navigator program, so we really believe in taking care of the whole patient. And it's people like Jim Calhoun and all of the riders who support us that enable us to continue our research.
And you also were telling me about there's some clinical trials going on right now at the center.
The way we make advances is through clinical trials. Every major advance that we've made in cancer has come through clinical trials. Clinical trials are complicated. The patients have to be informed. They have to sign for consent for the trial. They have to be carefully followed during the trial. And that requires a whole team. We need nurses, we need research assistants, we need data managers, we need a web-based entry system. It's very expensive. And we use the monies raised by this walk and bike ride to support our center.
And of course, I asked you, I said, I'm sure you've been to this fundraiser before. Are you going to walk this year, or you bike ride? How do you participate?
So this year I'm going to do the walk.
Okay, that's good.
But you should see that the teams that turn out, they compete, they want to win the race, they want to win the walk, and they want to win the race for money. So it's just really fun to see all of the organizations, all of the corporations support such a worthy event.
So far, there's been quite a registration turnout, and then can you register on site as well?
Absolutely.
Okay.
It's never too late. You can show up. And even if you don't want to walk or ride a bike, just come and join the fun. There are tents, there's education. You get to meet the coach, his family. It's just a really great day.
And some of the players as well. It's quite the atmosphere.
Yeah, the former players come out and ride with him. And he's very impressive. You know, this is a man in his 60s who's had multiple cancers, who gets out there and shows us that he can win the fight.
He is a fighter. Thank you, Doctor. I appreciate your time.
It's my pleasure.
And if you're interested, I'm sure you are, you can learn more about the NBC Connecticut Jim Calhoun Cancer Challenge Ride and Walk. Just go to our website, search links at nbcconnecticut.com. NBC Connecticut, proud to be partners in a caring community with the challenge.